So the Americans with Disabilities Act defines a disability as an impairment that affects an individual's quality of life in one or more areas. And that is generally the terminology that, or the definition that we use. In our clinic, we define a disability as anyone that has a developmental disability, a person who has an acquired disability. We also include the medically complex population as well as the psychiatrically complex, and we include the frail elderly in that category of disabilities as well. In addition to general dental problems, they also have, specific to their syndrome, malocclusions. Oftentimes they have structural deformities, mid-face deficiencies, failure of the bones in their face and body to grow properly. And therefore they may have malocclusions that make it difficult to brush and clean their teeth, and to speak and to swallow and to eat properly. So many persons with disabilities also take medication. The medication can create problems in and of itself. Many times the medications are in a sweet syrup to make it more palatable for the individual. And the sugar in the medication can cause an increased caries rate. Often persons with disabilities, particularly those individuals with autism or mood disorders, are on medications such as tricyclic antidepressants. These tend to depress the salivary gland flow and cause xerostomia in the individual's mouth, which also puts them at greater risk for dental caries. Many times persons with disabilities have oral habits and behaviors that compromise their dental oral facial structures. They may hit themselves, they may have self-injurious behavior, they may bite their lips, they may pick their lips or their faces, and that puts them at greater risk for dental disease as well. So with the Affordable Care Act, the doors have been opened somewhat for children with special needs. And children have always been a protected class. What we've found is that there's a real transition once they become 18 or 21, depending on what the guidelines within the state are. Many times an individual will lose their coverage upon their 21st birthday. And it seems somewhat ironic because they still have the disability. It's not as if the disability was cured, but yet they lost the coverage for services that they were receiving prior to the age 21. Another significant issue is, and it's state dependent, when an individual becomes emancipated. So a child will come with their parent or caregiver. The guardianship issues are not in question. Many times, as in the state of Florida, when you turn 18, you then become emancipated, which means an individual, a parent or a caregiver, must go to court, must have you declared incompetent, and then must petition to become your guardian, regardless of whether you're their parent or not. There are many different levels of guardianship. There's financial guardianship, there's healthcare, surrogacy, guardianship for living arrangements. So there are many tiers, and a parent has to be very specific about what type of guardianship they're going to be awarded by the courts for their child, and they have to petition, depending on the needs of the individual, to have full guardianship for all the different areas in one's life. And it can be a challenge.